Thank you for tuning in to the My Favorite Girl Caregivers Corner podcast, bringing inspiration, education, resources, hope, and strength to caregivers so you can keep going, keep pushing, keep loving, and by all means, keep caring. I am your host, Priscilla Jean-Louis. All right, welcome back, and thank you again for listening to the podcast. This is season 1, episode 6. And in this week's conversation, I'll be talking with Yarissa Reyes, who is the Director of Diversity, Equity, and Inclusion Engagement with the Alzheimer's Association. And we're going to be talking about Alzheimer's disease and clinical trials, why participation is necessary and needed. And so I just want to give a little bit of a background. I met Yarissa a few years ago when she was the president of communications with the Alzheimer's Association, and we contacted, and she and her team actually afforded me some great opportunities to be able to share my journey with my mom and Alzheimer's through different media outlets. And it's just been an amazing opportunity for me just to get out there and be able to share with others what this looks like, what caring in Alzheimer's looks like. And so I want to take this opportunity as well, Yarissa, and just say thank you for every one of those opportunities that you have afforded me. I am eternally grateful for those opportunities. So thank you. And as well, thank you so much for taking the time to join me today to talk about this very important topic.
Well, it is absolutely my pleasure to be here with you today. And it was such a pleasure meeting you and getting to know your story, and just fell in love with your entire family and how active you guys are in spreading the word and just letting people know that they're not alone, that we have similar journeys. They may not be the same. We know that when we meet one person with Alzheimer's disease, you're meeting just one person because everybody's journey is different, but there are some similarities in our journeys and, you know, the struggles that we go through as caregivers, as people who are supporting the person living with the disease. So it was absolutely my pleasure to get to help tell your story and to spread awareness. Now I have a new title, a new role with the association. I am engaging in diversity, equity, and inclusion, which I think is super important because we are so underrepresented. Minorities are. We are so underrepresented when it comes to clinical trials, when it comes to being at the forefront of new treatments. And it's a shame. I was looking at the statistics, and less than 5% of all FDA clinical trials involve minority populations. That's all minorities. That's Asian Americans, Native Americans, Hispanic, Latino, and Black African Americans. Less than 5% of all the trials. That's just not enough.
And
not acceptable. How are we going to find a treatment or a cure for all communities if not all communities are represented in those clinical trials? So that's where I'm here today to talk about.
Thank you. So that is so important. And I know when I was looking at the statistics as well, you're talking about 14% to 100% of, and that one statistic was in regards to African Americans, where, the prevalence is there for them, or for us, rather, I can't say them, us, to come down with Alzheimer's, and so we have to get into these clinical studies. We have to become a part of these trials. And so that's what this conversation is about today, to inform everybody about the clinical trials. I know for myself, and I'm sure others have probably thought the same way. When you think of clinical trials, first thing we say, nope, not going to be a guinea pig for anybody. Not going to do it. Am I correct?
That is the norm. Yes, that is the norm. And it's a shame because, people don't understand clinical trials. There are many different types. There's many different ways in which you can participate. and you don't have to be a guinea pig, like you said, and get, stabbed in the arm. There's many ways to participate. So we'll get into that. But I think maybe we should just start with what is a clinical trial.
That's it.
Let's just define that. So clinical trials are research studies. They're conducted with human volunteers. And the purpose is to determine whether these treatments are safe and effective. Without these clinical trials and the help of volunteers who are participating in the research, there will be no treatment. There will be no prevention. There will be no cure for Alzheimer's disease or any dementia. Because if you're not testing the possible treatment on a specific population, how do you know if it's going to work for them? It may not work for everybody. So that is the importance of participating in clinical trials.
And it's not just about rats and all this that other people look at. It's human volunteers.
That's right.
And that's the importance of all of it. If we don't get out there, and the whole point of all of it, or the whole thing about it, is education. Education is key to all of it. In my ignorance, I looked at it from that standpoint of no, not going to be a guinea pig. No, and then some aspects of it as well is, do I even want to know? When I thought about it, do at this particular state and point in my life, do I want to know? And reality is you do want to know. I mean, it's not, as I've stated before in other podcasts, it's not a death sentence. There's a whole lot more living that can be done and is to be done, but you got to get in, you got to be a part. And, we'll get further into the different ones, but even in looking at that, I thought about it even with this particular topic and looking at the vision for the Alzheimer's Association, which is basically a world without Alzheimer's and dementia. Mm-hmm. And I can honestly say, as a caregiver who day in, day out, I'm dealing with my mom, I'm looking at her condition, I'm looking at the effects of Alzheimer's on her. And I cannot say that there's anything else that I want more than a cure for Alzheimer's. I'm a granddaughter. I'm a daughter who's taking care of my grandmother and my mom right now, simultaneously, who both have Alzheimer's. They're at different stages. My mom's at a more advanced stage of Alzheimer's than my grandmother. My grandmother is 97. She'll be 98 in September. And so hers has a little more to do with age. But I will say that her memory is a little bit more sharp than my mom. Well, actually a lot more than my mom's. And so there's nothing else that I can say that I want more. I mean, I've seen this in my family throughout, aunts, uncles, cousins, all of that. And so when you look at it, I define Alzheimer's often as a very rude, disrespectful, mean disease. It's disrespectful, totally disrespectful to the person that has it. And so when we consider all of this, we're looking at how do we get to that point? How do we get to a world without Alzheimer's? And this here, the clinical trials and participating in the clinical trials is a step in that direction, right? And so you've already told us what the clinical trials are. So let's talk about the different types of clinical trials, because it's not necessarily, there is some part of you having, if you choose that one, to take some medications, but a lot of it isn't. There's a lot of them that we can become a part of that don't require that. So what are the different types of clinical trials that are out there?
Sure. So there are treatment trials, which are designated to test new drugs, sometimes non-drug-based dementia treatments, or a combination of both. So those are, you may have heard that aducanumab was just approved by the FDA last month. That was a treatment trial. That's where they were testing the efficacy of the drug, right? So that is a treatment trial. But there's something called diagnostic study, and these are intended to find new tests to diagnose a disease or condition or a procedure. So you will have diagnostic studies that look at PET scans, for example, and how can they look at the amyloid in the brain or detecting the tau proteins in the brain, things like that. So those are diagnostics. Then you have prevention trials. Prevention trials are the ones that are looking at ways to prevent the onset of a disease. An example of a prevention trial, it's to look at someone who may have had, a very sedentary life, not a lot of exercise, maybe a bad diet, and they look at improvements in that person's lifestyle choices. So, they start getting, better sleep at night, they start eating healthy, they start exercising, and then you look at the PET scans and you see, was there a difference in the way that this person was living before and the way that they're living now? Has there been a change in brain activity? So once you have the data, you can take a look at it and say, well, this might be a way to prevent the disease. So those are the ones called prevention trials. And some of them are just as easy as taking a survey. So you don't have to get poked in needles and things like that. Some of those are just as simply as, reporting on your lifestyle. Maybe they look at year 1 and then again year 2 and year 3, and has there been any changes in those years? There's also some that are just online studies. So they're just completely web-based. You fill out, like I said, like a survey, and that's it. That's as far as it goes. So it depends on your willingness to participate. And then something else that I want to make clear is that you don't have to have a connection to Alzheimer's or dementia to participate in a trial.
Okay, so
volunteer. You could be a healthy volunteer with no history of disease in your family. And the reason why we want to capture that information is because it gives us a baseline. You can compare what a healthy volunteer with no history versus someone who has a history of the disease in their family, and the connection, what's different, what works, what doesn't work. So we need all types of volunteers for clinical trials.
Okay, and that makes a total difference, just to know that I don't have to get poked, I don't have to take medication, because I think that's where some people stop at. When you consider some of the other trials, some of the other things that have gone on. I mean, a lot of people immediately, especially for African Americans, we immediately go to the Tuskegee experiment, which was very bad. And so when you consider that, I mean, some of the hesitancy is justifiable when you look at things like that. Even in your new role as the diversity and equity and inclusion, when you look at some of the diversity that there is in, looking at these things in these different communities, the inclusion, the lack of inclusion with it. So there is a lot of hesitancy in there, but it makes me feel a lot better to even consider it when I say, okay, well, if all I have to do is participate and get up and go exercise more, or instead of working off of 4 hours of sleep, get more sleep. That is very, very simple to do. And it doesn't really call for anything other than just them studying my habits over time. And so this is good information. And that's why educating yourself, is so, I cannot emphasize that enough. Education is so key, because we think certain things just based off of, sometimes very little information that we know on the information that we've heard. We don't even study far enough even into that to understand the fullness of it. And so we'll go on not knowing when these things are so very needed. I mean, for me, I want this gone. That's why I work as hard as I do. And I'm trying to work even harder in getting information, getting the education, the resources out there, because I have seen this affect my family in ways that, I wouldn't wish this on my worst enemy. You don't understand why certain disease. And again, I want to emphasize as well that even with this podcast, I know that I've spent a whole lot of time dealing with Alzheimer's. That just happens to be what I deal with. This podcast is not just for those with dementia and Alzheimer's, for all caregivers, just resources for all, because the same thing goes when it comes down to other diseases. When you talk about whether it's Alzheimer's, whether it's cancer, other diseases, we still need this same type of participation when it comes to these trials to try and find treatment and cures for all of them. And so we got to get connected. But today we're going to stick with the Alzheimer's. We want to be connected in a way that we can help and we can stop this for our future generations.
Absolutely. And you know, Priscilla, there's benefits of participating in clinical trials. Besides the fact that it's going to help get us to a treatment, to a possible cure in the future, there are benefits of participating for the people involved. If you think about the clinical trials, you're getting access to, first of all, potential treatments before they are available to anybody else, right? You have first dibs. You are getting expert medical care at the leading healthcare sites. So you're getting top of the line medical care support from the healthcare community, high level, best of the best. You know, you're getting the best diagnostics, the best, you know, possible healthcare support system. And 99% of the time, it's free of cost. Doesn't cost you a penny, right? So if you're someone who may not have access to health insurance, that is one way to get the best treatment at no cost. And, you know, people think about it, and it goes back to that stigma of the clinical trials that, oh, I'm just a guinea pig. But before it gets to the human face of the trial, there's been lots and lots of research behind the scenes before it even gets to that point, right? So there's different phases. There's phase 1, 2, 3, 4. By the time it gets to the human face of the trial, now you're talking about a lot of research behind it. You have the FDA looking at efficacy, safety standards. You know, there's a lot that goes into it. So you're getting the best possible medical treatment, a possible cure, right? Let's hope that's in the works. And you're getting access to that free of charge and before anybody else. So, you know, let's start changing the conversations around clinical trials. Let's start thinking about the benefits, the possible benefits for our future generations, like you just said. You know, if not for me, for my children, right, or grandchildren. We have to think about the future, and the only way we're going to make that possible is to include every single community to be involved, because we want a cure for all, not for some.
Right. And that's another reason why it's important for me. I'm a mom of 2 girls. When you look at the statistics, you're talking about women who come down or have Alzheimer's at a 2 times greater rate than men, you know? And so raising 2 daughters who knows exactly what this looks like. This is why, you know, I am and will be after this conversation, really looking at which one, but I will be taking part in the clinical trial because I want to be able to stop it, you know, before it can, God forbid, but come to them, you know. And, you know, even with these trials, they don't come without slight risk, but I look at it when you're talking about the ones that involve you taking medication, if you decide to go that route. But I look at it from the standpoint as well, even when you go get a regular prescription, it's going to give you side effects. You know, you're going to read all the possible side effects. And out of all the possible side effects, people still take their medication. And that's the reality of it, because it's prescribed. And so there's always that slight risk, but it's just that it's slight. It doesn't mean, but as you stated, there are experts that are following you, that are looking at this, that, are monitoring these things, that will be able to provide some type of answer or take you off of it, what have you. And so even with that, I think, just like you said, changing the perception, changing the perspective of what it really looks like. And so the risks that are there are minimal, when it comes down to it. And so we got to get this out there. Like, what are the benefits? And some of the same things you said, but providing hope for the people that live with Alzheimer's, their families. So even people that have been diagnosed, it is important for them as well to become a part of these trials. Am I correct?
Absolutely, 100%.
And what does it do for those who, when you're talking about an early diagnosis, somebody who's at that beginning stage or things are just starting to happen, how important is it for them to become involved?
Early diagnosis, early detection, early diagnosis is key, because the earlier you have an answer, the better you can prepare for your journey. You can make decisions. You can plan out, what route you want to take. There are options now. Aducanumab was tried on people living with early onset or early stage mild cognitive impairment. We know that it worked on those people, right? So the earlier the diagnosis, the better you will be prepared to take on the journey. You will have choices when it comes to treatment. You will have choices when it comes to, financially preparing your family for the future and what that may look like. You have more time with your loved ones. You have more time to do the things you always wanted to do, your bucket list, things like that. It just gives you control of your own destiny, if you will, right? And then the other thing to think about is, for us Latinos and for Black African Americans, we tend to get diagnosed much later in the stages of the disease.
Yeah.
That limits what we can do. That limits what options are available for us. So if we, as a society, try to work on early detection, early diagnosis, that education to the community, changing the stigma around the conversations relating to Alzheimer's and dementia, then we are empowering ourselves to make the decisions for our future. We'll have the early access to treatments like aducanumab, for example. And then, you can really plan out what this journey is going to look like. A lot people have concerns. I understand. I'm a minority as well. I get it. Trust me, I get it. But participants in clinical trials, they receive regular care related to the trial. They have the support system of the clinical trial staff, the medical staff. It is shown, research has shown, that people who are living with a disease, who are involved in clinical trials, tend to do better than people in the same stage of the disease who are not in clinical trials. And why is that? Well, it may probably has a lot to do with the care that they're receiving at this facility. And, just the high quality of care, that makes a big difference. So if we can get our people to join these treatments early, so again, early detection, early diagnosis is key, then we'll have a better chance at navigating the disease in a way that is, you're living with Alzheimer's, okay, but are you living well? That's the key.
Yeah, I was about to say that is the key. Are you living well? Now, let me touch on what you said a few moments ago when you talked about us as minorities being diagnosed a lot later. Mm-hmm. Why is that? Why is it that the diagnosis comes so late? Is it because of the medical doctors not knowing what it is? Is it from a lack of reporting what's going on, because sometimes people don't always say because of embarrassment or what have you. But why do you feel we are diagnosed so much later than others?
That's a great question. So a lot of it has to do with the fact that our communities believe Alzheimer's or dementia is just a normal part of aging. So we're not having the conversations with our doctors. We're not asking the questions. We're not demanding, that testing. Those are difficult conversations to have within the family and also with the healthcare provider. The Alzheimer's Association can guide families through this whole process. We can prompt those questions that you should be asking your doctor. What are some of those tougher conversations, how to get those started. But I think it comes down to, stigma. Certain communities, my own family, I'm speaking from experience with my auntie having Alzheimer's disease, they didn't want to talk about it. That my cousins, we grew up together, we were very close. They know I worked at the Alzheimer's Association. They still don't want to ask questions. Why? There's like certain stigma around the disease and protecting mom or grandmom or whoever the person is in the family. So again, a lot has to do with just thinking that it's normal part of aging, not knowing where to turn or what questions to ask the doctors. Sometimes there are comorbidities that happen with Alzheimer's disease. You've probably heard me say this before, that what's good for the heart is good for the brain, right? So when you're dealing with, hypertension, diabetes, heart disease, all those cardiovascular diseases that affect minorities more than whites,
Mm-hmm.
when you're dealing with all those things, you then forget maybe to ask the questions about the brain. You're dealing with diabetes, you're dealing with heart disease, you're dealing with all these other things happening to your body. So maybe that's not a priority to talk to your doctor about.
Okay.
So, there's a lot of different factors, but most of it comes from lack of knowledge.
Yeah. Yeah. And so knowledge is key. Knowledge is power. And we got to talk about it. We cannot keep it in the household. We cannot just cause it to just sit there, because the longer you wait, I know, like with my mom's dementia progressed so quick. I think that my own personal belief, she had a surgical procedure, back surgery, major lumbar fusion, and the anesthesia, in my opinion, had a lot to do with what I call pushing her right on over the edge. And literally, we're talking about, it's been about 5 years since I've been caring for her, but literally she had the back surgery, went from the hospital to rehab, was at rehab for, I think, 2 weeks, and started in the hospital, just the hallucinations. And I know that some of that comes from the anesthesia, but even when she got to rehab, people that would come and visit, and I noticed then one in particular, she kept asking the same questions over and over. And so that's when I really started like, okay, something's not really right. And she bounced back from it, but it progressed so quick after that. I'm talking about a matter of months after her surgery, we had to stop the driving, and then from there, it went to cooking and leaving the stove on and so on and so forth. She was already starting with the beginning stages. So she had already started with not remembering where keys were or her purse was. But after that surgery, it went quickly. And so to not talk about it, because and I often share, for us, my family, it was a matter of thinking that this is just something that happens when you get old. And I did no research. I did nothing because I was so familiar with it from having my grandmother as well as my grandfather, who both had it, and they were older. And so that was just the assumption, right? That, oh, this is just something that happens when you get older. And so now I'm at a place of making sure that I educate myself while I'm helping to educate other people, because it's not just that. It's not just when you get older. A lot of times it does happen to older people, but like you said, if we catch this early, the quality of life and the things that you can do. I mean, my oldest daughter just graduated from college in May, and she and my mom have been, tight from day one. And, she couldn't attend. She has no idea what graduation is, and so we don't want that to happen to other families, other people, where important milestones and just day to day knowing who your child is. We can slow this thing down, but we got to be able to do our part to make this happen,
Absolutely.
And so this brings me to our next, the next part of what I want to discuss, which is the Equity in Neuroscience and Alzheimer's Clinical Trials Enact Act that's been introduced into Congress. And this is a bipartisan legislation to support equity in Alzheimer's clinical trials. And it's been endorsed, of course, by the Alzheimer's Association and the Alzheimer's Impact Movement, the AIM. And I'm just going to read a quote that Dr. Carl Hill, he's the Chief Diversity, Equity, and Inclusion Officer, in regards to this bill. He stated, Alzheimer's and other dementia disproportionately affect older Black and Hispanic Americans compared to older whites. Yet too often the clinical trial staff and participants have not included significant numbers of Black, Hispanic, Asian, and Native Americans. There's an urgent need for our nation to do more to encourage and ensure diversity in clinical trial participation, and the Enact Act is an important step to addressing the shortcomings in our pursuit of health equity. So if you can just expound a little bit more on this act that is before Congress and how it can greatly positively impact our community.
Absolutely. The Enact Act would increase the participation of underrepresented populations in dementia clinical trials. And it's looking at expanding the education and outreach to these populations, as well as encouraging the diversity of the clinical trial staff as well. And it's also looking to increase funding for institutions that employ and serve minority populations. So amongst, part of the legislation is providing funding for the National Institute of Aging to expand the number of Alzheimer's disease research centers in areas with higher concentrations of underrepresented populations. Provide funding for resource centers for minority aging research to increase education and outreach to underrepresented communities and primary care physicians, because we want to educate the physicians as well, right? To let them know about current opportunities in clinical trials. The NIA, the National Institute of Aging, would enhance the diversity of principal investigators. So this is the staff, the people conducting the studies.
Okay.
So that they are more representative of the populations they're trying to enroll in the trials. That's key too.
Yeah.
The majority of the researchers are white. So if we're asking people to join the clinical trials, and we know based on the 2021 Facts and Figures report from the Alzheimer's Association that minorities feel like they're being discriminated against in the healthcare field. So by making sure that the scientists conducting the clinical trials are also minorities.
Yeah, we need some people that look like us.
That gives you a sense of, okay, they get me. You know, you feel safer, you feel more comfortable, you can ask questions and feel more at ease,
Right.
or at least that is the perception. So that's what the Enact Act would do. And why that is important, I mean, Dr. Carl Hill said it beautifully, but the underrepresentation of these populations not only hinders the ability of researchers to understand health disparities, but it also restricts their knowledge on how an approved therapy or diagnostic may affect the population that most likely need the drug.
Yeah. Yeah. We have to get involved. And so our part with that, and I will definitely be writing my congressman, but our part in this is to, one, if you need more information, go find out about it. I put the website up, and it's visit www.alz.org. You can go to the Alzheimer's Association website and you can find more information, or just go to Google. Go in Google and Google in the Enact Act, and you'll pull up information. So the first thing you want to do is find out more information. If you missed any part of that, go look it up. Look and see what all of that legislation is about. And then we got to help by raising our voices in support of it. Support this because it's needed. We got to get more, because right now, if I'm not mistaken, the clinical trials are not everywhere. So I can't just go, I mean, of course, the Alzheimer's Association, and we'll talk about that in just a moment, does have a trial match that you all do. If people are interested in becoming a part of one of the clinical trials, there's a trial match. And so, we want to be able to get it in those communities, in those areas where it matters most. So in order for that to happen, especially with this legislation, we got to do our part by calling, emailing, writing, putting it out there that this act is out there, and we need our legislatures, we need Congress to pass it, get it done. All right. So visit the www.alz.org, get information there, or simply Google that the Equity in Neuroscience and Alzheimer's Clinical Trials Enact Act is what it called. Google it, get the information, and let's get that information to others as well. Share the information with others in your sphere of influence. Wherever you can, share it. And ask others also to do the same thing, because in the end, it's going to help us, especially those of us who are minorities and need this to happen for us. Okay. And so let's go back and let's talk a little bit about the trial match. How does that match? If I'm somebody, I'm listening to this podcast, and I know that there's several out there. And so they're listening to the podcast and they're thinking after this conversation, I think I really want to try that. Now that I know that is not what I was thinking before, how can I get involved? How can I become a part of a survey, do a survey, complete a survey? I'm a caregiver. I'm someone who has it's been detected early. I have Alzheimer's. I'm a family member. I have several family members who too have Alzheimer's. So I want to be a part of this. How can they get involved?
The easiest way to get involved and to learn more is to go to alz.org/trialmatch. There's information there about clinical trials, like the things that we talked about, but then there's also a sign-up form where the beauty about trial match is like if you were matching for a date, right? You put in your basic information. You have a history of the disease, or you're living with Alzheimer's, or you don't have a history of Alzheimer's in your family. You put in just basic information and your email address, and the system will find trials that are open that matches the information that you put into the form. So it'll give you choices. It'll alert you if a new trial opens up. It'll send you an email and say, we think this might be a good match for you. So it's up to you to take action and decide which one you would like to try, but it gives you options. And, as we mentioned before, some of them may be treatment, some of them may be diagnostic, some of them may be prevention, some of them may be just web-based research. Plenty of opportunities. You choose which ones you want to participate in.
Will it require travel? Will I have to travel anywhere to participate in this? If I'm, in Florida, will I have to travel from Tallahassee down to Miami? What is involved in that?
That is a great question. And each trial is different. As we mentioned before, some of them are just web-based. Some of them are via phone or a Zoom type, video call. Some of them you have to be present, and you may need to travel. So it's up to you to decide which are more conducive to your lifestyle, to your available time. Some are one and done. Some may require follow-up visits. It could be a year from now. It could be 2 years from now. But you have to commit to follow through. Otherwise, it's not going to work.
Right. And I think that was one of the things that I saw on the website where it talked about the fact that, one, more people are needed. Two, more people need to be retained. You have some people that start and they don't finish it. And so it's hard to retain them, when they come on. And so it's that commitment to say, you know what, I want to make sure that my part in this is 100%. So getting in that commitment is definitely going to be another key factor because the trial will come up short if you don't follow through on it. And so making that commitment to do it, if you already know you can't travel, do one of the other ones. I mean, it's nothing to have somebody to follow you just to see if you go from exercising or not exercising, rather, to exercising, that made a difference. There's nothing to that. There's nothing to completing a survey. It just takes the commitment to say, I want to do my part. I too want to see a world without Alzheimer's and other dementias, because I care about not just my family, but I care about everybody enough to say, let's do our part to eradicate this. And I think that if we take on that responsibility, I promise you, if you have been involved in caring for somebody that you love with Alzheimer's, and you educate yourself in regards to what these trials look like, it would be so much easier to participate, because you don't want that to happen to anybody, especially those that you love, but to anybody. It is heart-wrenching. And I see it not just here in my own home, but even in speaking with other people. It's a hard disease. We don't take away from any other, definitely, but Alzheimer's and dementia is very hard. And so one of the ways to ease that is to become a part of the trials. I posted, just in preparation of this podcast, I posted question and answers section on Facebook, did a post, and I simply asked the question, whether or not, if you were able to take part in a clinical trial, would you do so? Mm-hmm. And I asked them to express why or why not. And I did receive a response back from one individual who stated that, yes, they would take part in a clinical trial. And they said because genetic propensity leads them to believe or want to know that there's a possible cure on the horizon. And then they also came back and asked a question, which I want to pose to you, Yarissa. And hopefully, if you don't have an answer, we can find that or just give what you know. But the question is, has baseline testing been found effective in early detection for those with a family history of the disease?
That's a very good question. Let's just start by saying that long before symptoms of Alzheimer's becomes apparent, there are biological changes occurring in the brain. You have the plaques, which are these clusters of protein fragments, right? You have the tangles, which is the tau, the protein tau. Those may grow, may cluster together, may get in the way of the brain's ability to function, right? That's when we get to that disease, that stage of the disease where it's diagnosed, those are the changes that we see in the brain. These biological changes can be detected early in the course of Alzheimer's disease through, PET scans, for example. And the Alzheimer's Association is working on a trial that we're very excited about called New Ideas, where we're trying to recruit minority populations to join so we can look at these PET scans. But back to the question, having a baseline measure of cognition before noticing any kind of cognitive change, any decline, it could be super helpful because it's hard to diagnose early if you don't have a frame of reference to compare it to. So, if people are considering getting a baseline evaluation, say in their 50s or 60, then it could be used as a way to track whether someone is experiencing true decline, later. When you're looking back, you can compare, right? Where did you start and where are you now? So I would say yes.
Okay, awesome. So hopefully they'll find that helpful and become a part of the trials. Become a part where they do the PET scan testing, because all of this is absolutely necessary and needed. And so I want to say again, www.alz.org. You can go to the Alzheimer's Association website. If you go to the search, you can type in clinical trials and it will pull up the information that has to do with the clinical trials. Of course, we could not discuss every single part of it during this 45 minutes, 50 minutes of a podcast, but for additional information regarding the Alzheimer's disease and the clinical trials, go to the alz.org website. You'll find that information there. And if you have any additional questions, would like to get more information, you can contact Yarissa Reyes at YOREYES@alz.org. That is her email address. And she is very consistent with getting back with you with the information that you need. And so contact her via email, ask additional questions if you have them. And as I always say, the Alzheimer's Association has a vast amount of information out there for you if you are someone who is dealing with the disease yourself, you've been diagnosed, or if you are a caregiver for those you're caring for someone with Alzheimer's, one of the other dementias. You can find a vast amount of information out there. There's videos out there to help you. We introduced last week to the podcast the Essentials training that is out there. I am currently taking part in that training. And so that is a training for direct care workers. There's a whole plethora of information out there. And so educate yourself. Again, we want you to look up and become familiar with the Enact Act and go out there, look it up, the Equity in Neuroscience and Alzheimer's Clinical Trials Act. Go out there, look it up, get the information, contact your legislatures, contact them and ask them to help us to get this act passed, because it's very, very necessary. Those of you out there who are considering, don't consider anymore, go ahead and sign up to become a part of one of the clinical trials. Let's get matched. Give us that website address again, Yarissa, to be able to sign up for the trial match.
alz.org/trialmatch.
All right. Thank you again, Yarissa. Is there anything, matter of fact, I want you to just give a little advice. If there's somebody out there that's teetering between whether or not I should or shouldn't give a little bit of advice to help push them over to come on and take part in the clinical trials?
Well, the only thing I could say is if you're thinking about it, take the next step and at least just go to alz.org/trialmatch and see what sort of trials are available. Read about them, think about it, and then make the choice. But at least take that first step to try to get matched because that's important. The only way we're going to get to a cure, the only way we're going to get to effective treatments for all communities is if we all participate. I'm signed up, my family signed up. We're not going to be able to see a world without Alzheimer's and all other dementias without people participating, so that we know what treatments are available that are going to work for us. So take that next step, read about it, sign up on alz.org/trialmatch, and see what's available to you. Now, the great thing about Florida is we have very, very good institutions here. You got Mayo Clinic, you got Miami, UCSF and UCF, and all of these great research institutions, Bird Institute. I mean, there's so many here in Florida. If you don't want to travel and you just want to do the surveys, that's fine. Every little piece of data is going to help. So take the next step, sign up for TrialMatch, and see what's available that may fit your schedule and your lifestyle.
I'm signing up on TrialMatch. I'll be doing it, and I'll keep you all posted as well. So take that next step with me, and let's make this happen. Thank you again, Yarissa, for your time. We appreciate this opportunity, and I'm looking forward to working with you even more in the future to get this as well as other information out there for our community. Thank you.
My pleasure. Thank you so much.
Thank you so much for listening to this episode of the My Favorite Girl Caregivers Corner podcast. Hey, do me a favor and follow on whichever platform you're listening from so that you can receive notifications when the next episode is out. And also share it with a friend. And remember, no matter what, keep going, keep pushing, keep loving, and keep caring.